You wake up in the morning, stretch, and instinctively swallow. Suddenly, it feels like you've just swallowed crushed glass. For many of us, that intense scratching pain triggers an immediate reflex. We assume we need a doctor's appointment and a prescription as soon as possible. But looking at the data, the medical reality is quite different. Out of 12 million annual clinic visits for sore throats in the US, a massive 90% of adult cases are viral. Biologically, antibiotics are completely powerless against a virus. Taking them won't cure your throat, but it will expose you to side effects like rashes, diarrhea, or more serious allergic reactions. Instead of defaulting to medication, doctors use this specific clinical roadmap, called the evaluation of acute pharyngitis in adults, to sort patients into the right level of care. Navigating this medical flowchart allows you to separate common viral discomfort from a situation that actually requires clinical or emergency intervention. At the very top left of the flowchart, doctors first look for signs of a severe, deep tissue neck infection or an airway obstruction. These are mechanical failures of the throat. This includes a muffled hot potato voice or drooling because a patient physically cannot swallow their own saliva. They also check for respiratory warning signs like stridor, a high-pitched strained sound while breathing, or an incredibly stiff neck. If any of these specific red flags are present, you bypass the standard clinic. That is an immediate trip to the emergency room for stabilization and imaging. These deep space neck infections are rare, but recognizing these mechanical failures ensures a patient reaches life-saving care without delay. If the red flags are clear, we move down the tree to the most common scenario, a viral upper respiratory infection. Viruses are typically systemic. Instead of a localized throat attack, they usually bring along a runny nose, a persistent cough, or irritated red eyes. When you have these respiratory symptoms, the evidence-based treatment is supportive home care. You manage the pain with ibuprofen or acetaminophen and use saltwater gargles to soothe the tissue. There is one modern exception for specific testing. If you know you've been exposed to COVID-19 or the flu, a targeted test might be necessary to protect others or to access specific antiviral treatments. Aside from those exceptions, the presence of a cough or runny nose is a strong indicator that the infection is viral and antibiotics will not be effective. That leaves the 10% of adult cases that do require targeted medication, Group A Streptococcus, or strep throat. Take a look at this medical illustration. A strep infection presents with a very specific physical profile, a sudden fever, swollen glands in the front of the neck, and white patches of pus on the tonsils, all while notably lacking a cough. If your symptoms match this localized, aggressive profile, you should see a doctor for a rapid throat swab or a lab culture to confirm the presence of the bacteria. Once confirmed, antibiotics like penicillin are prescribed for two reasons. They stop the contagious spread, and they prevent rare but severe immune-mediated complications, such as rheumatic fever. A true strep diagnosis is a localized bacterial strike, making it distinctly different from the widespread respiratory misery of a common cold. Looking at the complete clinical algorithm, the framework involves 3 steps: check for emergency red flags, look for systemic viral symptoms, and watch for the localized strike of strep. Managing a sore throat effectively depends on looking at the other symptoms it brings, the company it keeps. For the vast majority of adults, a viral sore throat is simply a waiting game that resolves on its own within 5 to 7 days. Mastering this clinical logic transforms a morning of painful panic into a specific, safe plan for your recovery.